Tell us about your delivery story.
So I was pregnant with my son, Jordan, and around 24 weeks, I was a high-risk pregnancy, and they had started to notice that I was feeling contractions. But at the time, they weren't doing anything. They were just kind of contractions that were happening, and so they started looking at my pregnancy, and they realized that I had too much amniotic fluid, which is not a big deal except for the fact that it can cause you to go into preterm labor. So I started going to extra appointments, and they were kind of measuring where the amniotic level was, and they put me on kind of a modified bed rest where I could be at home, but I could just go to work and sit at work and then go straight home afterwards. So nothing like going and walking around or going to the park or out to the mall or anything like that. And around 34 weeks, I had an appointment to go and check in one more time on my amniotic fluid level, and it is considered high when it is between 20 and 25 centimeters, and I was at the time 26 centimeters. So I definitely had a lot from the amniotic fluid. And so what they did was they got I had a regular doctor's appointment, and they went and sent me to my regular doctor's appointment. And at that point, we went ahead and ran some tests. I had an NST scheduled, which was a non-stress test, and then they also checked me, and I was a centimeter dilated. At the time, I kind of just figured they would stop it because, well, that just seems like something easy to do, and it wasn't quite that easy, so they sent me to the hospital to run some more tests. And by the time I got to the hospital, I was 3.5 centimeters dilated, and it was happening. So one of the NICU doctors, Dr. Kicklighter, came in to talk to me about some of the things that could be going on. Sometimes you randomly have too much amniotic fluid, and sometimes it's because the esophagus didn't attach to the stomach for the baby. So they were preparing me for potentially a surgery after he was born. It was a C-section, and an urgent C-section, because the way his cord was, they didn't want a prolapse cord if my water should break. So they had to go ahead and get that done before my water broke. And he came at that point, so it was 34 weeks and 5 days, so almost 35 weeks gestation. And he was perfect. He was struggling to breathe a little bit, so he got on a CPAP and then a couple other things. But the good news was the test that they ran, he did not have to have that surgery, so I was able to see him after.
Can you tell us about your NICU story?
Yes. So they ran those tests, and that was the first thing, and then they put him on the CPAP, and they were preparing, since he was born November 30th, they were preparing for at least one holiday, but potentially New Year's Eve in the NICU. So the good news was he did pretty well the first couple days. He was able to get off of the CPAP and be on room air, and he was a big boy. When he was born, he was 7 pounds 10 ounces. So he was not, it wasn't a big deal about the feeding growing. We had a couple bumps in the road in the fact that he wasn't really latching on very well when it came to breastfeeding. So even if I had enough milk, he would latch, he just wasn't eating, what he needed to. So thankfully, my husband and I realized pretty quickly that if we just did the bottle with the breast milk, he did a lot better. So luckily, when it got to day 5, they started preparing us and kind of letting us take the car seat test and letting us watch the videos, and they started to kind of get us ready. He did have some bilirubin issues, so they did have to put him under that, but for the most part, he did great for the 6 days that he was in there, and then we were able to be discharged and sent home with just the short stay in the NICU.
So tell us what it was like when you went home.
When I went home, I was petrified. Probably the scariest that I have ever been. And it was it was just little things. I think I was so exhausted. I remember the first night I was so exhausted I fell asleep, and you're used to like the monitors and the stuff and the noise just blocking it out. So when he started crying, I didn't even wake up. My husband did. So at first I was just like, oh my gosh, I'm like failing, like colossal fail as a mom. I can't believe I didn't wake up. But my husband was really, really good about like, explaining that it was just the stress, and I was so nervous about doing everything right. And keeping him, at home. I think the hardest thing too is that it was during that cold and flu season and RSV, so it was hard to just be home. And one of the things that I think, one of the challenges for sure when we got home was the fact that because it was a short stay, we didn't necessarily have all the same needs as some of the other preemies, so we didn't have that same support either. So we didn't know what things to look for. We didn't know that maybe you could do some things outside the home during RSV season, but some other things were a risk. We just kind of, okay, you don't take them out. So I think that was a challenge in not having, with a short stay, not having that same level of need for support, but still needing somebody to say, you're on the right track. So that was certainly our challenge when we were home from the NICU for sure. But it went very well, and luckily it was just the regular kind of pediatrician visits that we had to have. So, yeah.
Have you had any challenges since being home?
We did have some challenges, and again, I think a lot of it is the kind of the extra support that you do need a little bit when they're short stay. He does go to occupational therapy for sensory overload issues, and that's actually a common thing, especially for boys that are short stays or like in that 33-week to 38-week gestation when they're born. That sometimes, because that's when your senses are really developing in the wound, and you can start to handle like the touch of things and the smells and tastes and stuff like that. So if multiple senses are being used, he really struggled with banging his head and having, yelling, screaming matches, things like that. So thankfully we got him into occupational therapy, and now he's doing completely fine. But at first that was really a challenge, especially from that like 4 to 6 month area up until about a year and a half. We really struggled with making sure that we didn't have multiple, like if you had a noise and a sound and like a light toy and everything going on at once, it's a little too much for him to process. So, but we got there.
Tell us what you wish you had known.
I wish that somebody had told me that you can do it without a doctor or nurse team, because when I got home I was thinking that I'm not going to be able to do this. And I really wish that someone had also told me that it's okay to make mistakes. They're not going to break or anything worse, God forbid. They're going to be okay, and that it's okay to kind of get attached and kind of get to know them. Like, yeah, you did the kangaroo care and you would change the diaper and stuff, but it wasn't the same as when you got home. So I wish somebody had kind of told me it's okay. You need the doctors and nurses, but not for everything. You can have that family care and that mommy and daddy kind of interaction and do some of the things on our own. So I wish I'd known those two things to kind of get me through kind of the ups and downs. And then as a female, I wish that somebody had like told me a little bit more about it's okay, your emotions, because you have a baby and then you're in a high stress situation. So there were certain, like definitely 2 times where I had just complete breakdowns in the NICU, and I can't tell you now what it was because I don't remember. So it definitely wasn't a major thing, but at the time it seemed major. So I wish that there might have been a little bit of help for, someone who as a mom had just had a baby and had major hormones going crazy.
So how is your baby now?
Jordan is wonderful. He is 4 years old, just had his 4th birthday, and you would not know any different. He's completely resilient, and I'd say it's interesting. You never want your kid in the NICU, but there are certainly things that at the NICU I learned and developed, or he learned and developed, that now have kind of been a blessing in disguise. So there's lots of things that I'm very thankful that I had the NICU to kind of guide the way a little bit, unintentionally, but it worked out great. So he is doing wonderful, growing strong in preschool, and I can't thank we've met enough. But I hope that this support continues for the moms to get you to that moment of being able to say you did it and they're growing up and they're perfect.